I want to talk about gender norms in developing countries, and this is something that I came to, that I evolved into as I went through my career. I started out focusing on newborn health in developing countries because there was such a huge gap there and a huge lack of attention, resources, everything else. That led me into thinking about child nutrition, led me into thinking about maternal nutrition, maternal health, led me to think about family planning and broader issues of women's health. And the more I went through my career and was out in the field seeing what the realities were on the ground, the more I came around to thinking, I need to address this issue. This is really what is fundamentally holding us back from so much of our progress in all of those areas. And within this area, as I began to think about gender equality and its relationship to health, and how do you influence gender equality, drive greater gender equality for its own sake, but then also think about the links to health, I began to realize that this is a primary driver of so many things that we want to achieve in this day and age around the Sustainable Development Goals, in enabling all people to achieve their full human potential. And that rather than think about trying to address gender equality one issue at a time, you could go after intimate partner violence, for example, you could go after child marriage, you could go after dowry issues. I mean, there are many ways that you could attack this problem. I began to ask some very fundamental questions about what is underlying so many of these inequalities and how are they linked to health? And are there more fundamental principles that we could understand and that we could begin to think about how to address them that would have manifold impacts across many different health outcomes, for example. So that was a bit of my journey that led me into this. So you've heard a little bit about gender norms and how they're defined. They are kind of these both spoken, learned, and unspoken, assumed rules that kind of govern our lives and ways in which we think that we should think and ways that we think that we should act. They're guardrails within society, and they not only affect what we do, but they very much impact what we even imagine might be possible for us to do. So they're really very all-encompassing and influencing who we think we are, what our relationship to others within society should be, and how we're going to behave within society. Gender bias is when this turns into a prejudice, where in viewing somebody and making a judgment upon them based on their sex, we immediately assume certain things about them, what they should be doing, what they might be capable of doing, and this has all kinds of ramifications, some of which we've listed here, which we see coming out as gender inequalities, gender disparities, gender discrimination. We see it everywhere. This is a global issue. We see it right down the street. We see it on our own campus around differentials by gender and opportunity. In some of the places where I go in developing countries, it has egregious impacts on people's health and opportunity in some of the ways that I've listed here. So what does this look like in developing countries? Janine at the beginning indicated that a key question that's, the first question that's asked about us when we're born is it a boy or a girl? In places where I work, it may mean that the birth attendant doesn't get paid if he or she delivered a girl. It may mean that the mother may be shunned, or maybe she'll be beaten for delivering a girl, particularly if it's her second or third girl with no boy. For the girl, it immediately means, in many cases, that rather than the possibilities that her life brings, it's more about how do I limit the liabilities that she's going to bring to our family. It changes everything, and it certainly changes many opportunities. Here, a fact about how family poverty impacts girls' health in something so obvious and so huge as mortality, more so than boys. Pretty alarming statistic here. Women and girls are excluded from decision making. I mean, that again happens right down the street, but we certainly see it globally in positions of power. And in the higher positions of power, even in those positions, usually women are in them in relation to caregiving kinds of activities or educational kinds of activities. They tend to be shunted more into those kinds of even leadership roles if they happen to be able to get that far. Exclusion from financial systems, not being able to have control over money, not being able to have a bank account. And the work that women do becoming invisible and them being directed towards work that tends to be unpaid, with the vast majority of unpaid work around the world being done by women, and it is literally undervalued. Wanted to present a bit of a case study. These are the kinds of examples that I was seeing as I was going out in the field and looking at programs that were being funded. I've kind of disguised who this was because this is a very general thing. This is not particular to any one organization or any one set of circumstances. In this particular case, this was an example from agriculture where a number of innovations and technology improvements around growing soybeans was introduced into an East African country. And the aim of this program was, for one, they thought that it would put more money in the pockets of women, that those women would spend that money more on their family, that there would be more protein available in the community, and those women would be able to feed this higher protein content food to their children. Their children's health would improve, their economy would improve, more kids would be in school, and the whole community would benefit. This was the conceptual framework that was funded, basically, when this project was launched. 2 years later, it turned out that girls were dropping out of school at higher rates, and there had been no nutritional impact on the community at all. And it was rather startling to see that this money had been invested with really good intent and a conceptual framework that seemed to make sense. And beyond this, it actually turned out that some women were being subjected to violence. Increased intimate partner violence was beginning to occur in this community. If we had time, I'd ask you questions and get your thoughts on how this came about. We don't have quite time for that. So I'll explain a little bit of what happened. In these communities, caregiving activities around the children are managed by women. And men, by and large, don't have much idea of what's going on. Men are excluded from childbirth. They're excluded from feeding activities around children. So for them, the idea that a higher protein food was going to be fed to their children was kind of beyond their everyday experience. It's something that they didn't relate to. What they could relate to is that this crop was bringing in money. And the crop was initially directed towards women, thinking that it would benefit women, but typically low-producing crops, low-value crops, are given to the women to grow, and the men grow the higher-producing crops that bring more money. And as those crops were producing more money, the men got interested. And it was about the money, and the men began to take over the markets. They began to control the money. And so you didn't see really the benefits that were postulated would come through the mechanisms that seemed to make sense at the beginning. And when women resisted, men fought back. And they seized control over the money and the ability to manage this successful crop. So from an agricultural standpoint, initially it seemed successful. Production was going up. But when you came down to looking at it through a gender lens, there were a lot of actually harmful things going on with the community, within the community. And as I began to see these kinds of experiences, I began to realize that it's simply not okay in this day and age to go into a project like this and not to consider these kinds of gender dimensions and to potentially be doing harm and not even realizing it. You know, as physicians, we take a Hippocratic oath, and I began to think, why in the world is it okay to go in and do public health in this kind of a manner and not make measurements, not be monitoring, not even have it on the radar in terms of these negative ramifications that may be going on and the ways in which your conceptual framework is really not playing out because fundamentally gender roles and power structures that in this community were favoring men. So how are these gender norms formed? This is something that we're all very familiar with. These are words that were extracted from commercials advertising toys. And whose toys were these? These are toys that were meant to be marketed to girls. That same analysis extracted the words from toys meant to be marketed towards boys. And as you can see, they're markedly different. And these happen to be toys that were marketed towards 6- and 8-year-olds, but this even begins much earlier. Very subliminal messages about if you're a boy, this is what you should be engaged in. And if you're a girl, you're engaged in much different things. Being socialized to think and act in different ways. Probably many of you have seen this recent study that was published in Science that began to ask the question, when do these kinds of attitudes begin to emerge? And this one took the point of view that if you look in academic centers, even like our own, and where you have many more men than women, proportionally more men, there must be perhaps an element even of expectation or even of what might be possible that may be different between men and women. And when does this begin to emerge? And their conclusion was around age 5 and 6. Kids are starting to differentiate who they think is super, super smart and who ought to be making choices that would lead them into occupations where it's expected that you're going to be super, super smart. At 5, they were pretty equal. By 6, they were starting to see this differential emerge that widens, and by adolescence, it's really quite wide, where confidence levels between boys and girls are differing and expectations are differing. This was work Ann Weber led in analyzing. We took a look at child development in a group of East Asia Pacific countries and looked at differences between boys and girls' development in relation to socioeconomic status and in relation to gender equality, in measures of gender equality within that country. And it turned out that gender equality was a very strong factor that was associated with girls' increasing performance and in fact a widening differential between girls and boys, with girls actually outperforming boys in measures of child development. These were 3- and 5-year-olds. A lot of questions there about what's going on in more gender equitable cultures, such that the girls' development is overtaking that of boys. It probably, to some extent, we know that there's some data to suggest that in the situations where there's gender inequality, that it's much more the mother who is delegated all of the child caring and the interacting with the child. In the gender equitable societies, it's more equally shared between the men and the women. That was one factor that we were able to uncover. But a lot of questions there as to what's actually going on within the home and within that child's environment that's creating this situation. Marcela Alsan led this study looking at differentials in secondary education, secondary school attendance between girls and boys globally, and chose households where you have an adolescent boy, an adolescent girl, and one or more children who are younger than 5. And basically postulated that there's a norm where the value of education for a boy is deemed to be higher than for a girl. And if push comes to shove, you educate the boy and you take the girl out of school. We see this in many low-resource settings around the world. The data actually bore that out in that there was a gender gap in secondary education attendance of about 5 percentage points between boys and girls, boys higher than girls, where a young child in the home became ill, the disparity, the gender gap widened, and then when there was a working mother in the home and you don't have social supports for mothers and for families in these kinds of situations, the gap widened even further, suggesting that there's a norm that if somebody needs to stay home and take care of a sick child, rather than pull the boy out of school, we're going to pull the girl out of school. And in some cases, it'll be the mother who can take care of that child, but where the mother's not available, the girl is increasingly relied upon rather than the boy, and is pulled out of school and suffers the consequences to her own education. So we see these kind of large global trends going on that reflect strong norms that tend to be fairly pervasive. This was our conceptual framework that we think was really borne out. With increased childhood illness, you had increased care need at home. The older sister pulled out of school, results in lower educational opportunities for those girls and a vicious cycle that negatively impacts girls relative to boys and widens the disparities in the opportunities. This is data looking at, on your right, the fact that in developed nations, boys and girls are really scoring the same. These are scores around subjects of science, with the scores being the same, but yet on the left side, the choice of going into science-based disciplines being widely different, with the boys essentially being socialized more to going into those activities compared to girls, despite the fact that their performance is exactly the same. And this is something that we're seeing even in today in developing countries. There's some very recent data coming out. A group at Johns Hopkins is looking at early adolescence. I have a colleague in the back from Pop Council doing a lot of work also on early adolescence and looking at norms around the world. And in general, it's a very pervasive view around these gender stereotypes that I note here. Girls being seen as vulnerable, boys being seen as strong and much more independent. Boys are typically seen as the predator, not thinking that at times they become preyed upon. Girls being potential targets and victims. As a result, girls' mobility needs to be restricted. Girls' opportunities to get out needs to be restricted. They end up being married off sooner, having children sooner, and it has massive impacts. As we see here, just simply showing the relationship between educational level and infant mortality. The more girls are prevented from gaining that education, they're put into a group where mortality rates are higher. And similarly, as babies are being born to adolescent girls before they're really ready, the mortality among their infants is also higher. Boys, on the other hand, with this freedom, they're expected also to conform to certain ideals of masculinity, that they're tough, that they are independent, that they don't need help. And we see boys adopting harmful behaviors, as Mark really clearly pointed out in his global data as well. Boys, simply put, tend to fight, drink, smoke, and use drugs more than girls. This is global data looking at DALYs, disability-adjusted life years, for adolescent boys versus girls, and looking at the risk factors underlying those DALYs. And you can see they're markedly different for boys and girls. For the boys, it's primarily consumption of alcohol, physical injuries, unsafe sex to some extent. For girls, it's really more variable, but much less around these kinds of behaviors. This is some data globally looking at women's unmet need for family planning. In other words, a woman, in this case, married women, who don't want to be pregnant but yet don't have access to contraceptives. And this is what the global distribution of this indicator looks like. And there are many reasons for it. Some interesting data, though, that also comes out of the DHS, asking the question, is a woman justified in refusing sex with her husband if she knows he has sex with other women? And looking nationally at the response rates, and where women increasingly at higher rates are essentially saying, well, no, a woman actually is not justified in refusing sex. In those kinds of settings, it's more where the unmet need is very high. These are the kinds of relationships that in global data we really haven't looked into. What are the norms? What are the attitudes that women are holding, that men are holding in these situations that are impacting a outcome or a measure like unmet need for contraception? These are some of the questions that we're beginning to try to explore to understand what some of these pathways are between norms and health outcomes or health behaviors. I would encourage everyone, if you haven't seen this video, I'm not going to play it here, but it gives you a sense of what adolescent boys and even younger boys are hearing and the ways in which they're being very specifically socialized around certain attitudes and certain behaviors. And so as a way of saying that this is pervasive, these norms affect all of us. In developing countries, we often see egregious inequalities that are affecting women and girls, but men and boys are also being impacted, again, as Mark's data, I think, very clearly shows. So with this background, just a few words on some new work that we've undertaken here at Stanford. We're putting together a series of articles for The Lancet that is trying to really unpack this relationship between gendered social norms and the impacts on health, trying to understand what those pathways are, trying to understand what we can potentially do about them, and ultimately come around to a global call to action. Here's our basic hypothesis, that in today's age of the Sustainable Development Goals, in which we're aiming for a more just, equitable, prosperous world, that there's no way that we're going to get there unless we better understand and more actively address gender norms, the socialization processes that create them, and work to optimize health and development outcomes through these means, in addition to the typical kind of biomedical interventions that we're used to thinking of and that I've spent much of my career trying to develop. And again, by transforming these norms and addressing these inequalities, that we can improve health and well-being for everyone globally, that we all stand to benefit from this. These are the 5 papers that we're working to develop. The first is really a conceptual framework, and how do we think about these issues, and how do we use that conceptual framework to guide our data analyses, thinking about how do these norms form, what shapes them, what changes them, and what are their relations to health, what kind of attention are these issues getting. The second paper is really looking at existing data and what can we learn from data that we already have that give us insights into where norms are affecting health. And here we're using survey data, longitudinal data as well. The third paper is taking a look at the evidence for what has been tried to shape norms, what works, what doesn't work, and what's the impact of these measures on health, including research, program evaluations, and the introduction of policies. The fourth paper is looking at what does this look like within systems. So many of these processes are institutionalized not only within our homes, but they're institutionalized even at the level of health systems and the way those systems are formed and maintained, and the power structures that are being perpetuated through these systems and the impacts that they have on health. And then the fifth paper is our call to action. So here, just very briefly, is our initial, and this is kind of a pared down version of our conceptual framework, in which we're trying to relate sex and gender. And you can see here that there is a pathway directly from sex to health outcomes. But I would maintain that much of this actually goes through this process of socialization that happens at the household level, the community level, within institutions, more broadly within society, that much of it is wrapped around power structures, power differentials, and that gender dimensions are also related to other intersectionalities like race, class, etc. And so we're trying to unpack with data what these relationships look like, what do these socialization processes look like, and then ultimately there are these gendered pathways to health that happen at the individual level, the social level, etc., trying to unpack what do those pathways look like that ultimately lead to health outcomes. And part of what I would propose to you, and I'll come back to here a little bit further, is that I don't think that we actually have either sex disaggregated or gender disaggregated data. We're seeking them both, but currently we have a mix of them, as I think our pathway tries to illustrate. And how do we untangle them? I mean, Londa, your work is attempting to untangle the sex and the gender elements here, but it's really a challenge, and currently I think we have a mishmash of sex and gender-influenced data. So if we're trying to understand how norms impact health, first of all, we have essentially no data on norms. They're very hard to measure for some of the reasons noted here. As we just saw in our conceptual framework, norms function at various levels. One of the levels is within the home. Very difficult to understand how norms are functioning within households. And when you look at global data, we have very little insight into what's happening among different individuals within a household. So very little insight there. Often when you start talking about norms, you're talking about how somebody thinks they should behave in relation to what others' expectations they think they have for them. How do you unpack that? Simply by asking people questions, particularly people who often don't have a lot of educational exposure, and you're proposing questions that are really difficult to wrap your mind around and that are really quite abstract for people. And then as we think about, who is the influence upon you that forms the community that shapes the norm from your point of view? How do we define that? That's something that we're trying to think about quite a bit in our analysis of data, is how do we actually define that community of influence that goes into shaping a norm. So here are a few of the challenges with data that we've uncovered as we've gone through this process, and we're really quite in the thick of it. First of all, there's a huge bias in who is surveyed. If you look at DHS data, for example, it's a little bit mind-boggling. It's almost as if you matter when you're born, you matter until you're age 5, whether you're a boy or a girl. After that, no one cares until you become pregnant. That's kind of what our data says. I mean, we don't have any information on adolescents in these large surveys, and so there are special efforts to try now to collect information on adolescents. Information on men is really spotty for reasons that often aren't clear. It's in some survey, it's not in others. There's more missing data there about men. It's as if, well, they kind of really don't figure in. But if we're going to understand gender differentials and gender disparities, we have to understand what it looks like from both sides. And we, by and large, don't have that data currently. Bias in the types of questions that are asked, and we've just listed a few of the kinds of questions, the way those questions are asked that are different for men and women and that reflect certain biases. Intimate partner violence, women are asked, men are not, whether they've been the subject of violence. And stark differences there. When it comes down to work, some of the economic implications of gender bias. Around unpaid work, it's as if it's non-existent. But yet we know that's where women are spending massive amounts of time, particularly in relation to where men are spending time. And so we're not capturing any information in these large surveys on those elements. Bias in the construction of questions, even. Look at the wording on some of these. Being a housewife is just as fulfilling as working for pay. That question is never asked in the framing of men. When a mother works for pay, the children suffer. It's never asked about men, whether that's true. On the whole, men make better business executives than women do. There's an assumption that's built into that question, but these are the questions that are being asked globally in surveys like DHS, and where we really need to make improvements. And then there's the differences, the attempts to measure people's attitudes about things, their behavior, perhaps based upon those attitudes, but perhaps based on other things that they're responding to in their environment that are normative in their environment. And so we're beginning to try to unpack data like this, but you have to wonder what kinds of biases are inherent in the answers that people are being given, much less the questions that they're being asked. So huge biases in the data that we're looking at. So quickly in summary, gender norms matter hugely for health, very pervasively, and we're trying to define that much more specifically in the work that we're doing. As I mentioned, we think that disaggregated data is really a fallacy at this point. There is no purely sex disaggregated data. There's no gender disaggregated data, and we're trying to figure that out. Data has many built-in biases, the data that we have, but nevertheless, we do think that insights can be gained from the analysis of existing survey data, existing longitudinal data, where you can look at changes over time and try to relate factors that may have mediated those changes. And I think there's mounting evidence, and we're aiming to add to that evidence that reducing gender bias in data will enable us to gain greater insights that can lead to more effective policies, more effective programs that will improve people's health and well-being and lead us closer to having the equitable, prosperous world in which all people reach their full human potential. Thank you.